Bonjour tout le monde. My name is Sheila Tuddenham, and I am a member of the Board of Directors at the Ottawa branch. I would like to begin by recognizing that the Ottawa branch is located on the unceded territory of the Algonquin Anishinaabe Nation. We extend our respect to all First Nations, Inuit, and Métis peoples for their valuable past, present, and future contributions to this land and country. On behalf of the branch, I am pleased to welcome you to today's webinar entitled Tools for Caregivers, Managing Stress and Emergencies with the Ontario Caregiver Organization. I would like to give a warm welcome to our presenter today, Anne-Marie Boutiette. Today's presentation will go over why stress and burnout is so commonly experienced by caregivers, how to recognize indicators of that stress, and strategies to help you manage it. Anne-Marie will also cover how to plan for emergencies and to build a contingency plan, highlight some free programs and services offered by the Ontario Caregiver Organization to support caregivers across Ontario. Before we begin, I want to give a special welcome to anyone here who is not yet a member of the association. We hope that these webinars will inspire you to join us. And to our members, we hope that these webinars will encourage you to maintain your membership. I also want to mention that closed captions are available in both French and English. To access this feature, click on the Closed Captions button at the bottom of your screen. And to translate to French, you can click on the little arrow next to the Closed Captions button and select the Translate option. Finally, if you have any questions for Anne-Marie, please type them in the Q&A box on Zoom. We'll have a Q&A session at the end of the presentation. That's all from me, so I'll pass it over to Anne-Marie. Welcome, Anne-Marie.
Thank you so much, Sheila. Thank you for having me this morning. I'll just take 1 second here to share my screen with you all. All right, everybody can see that?
Yep.
Just a reminder that when I'm presenting, I can't really see the group, or I can't see Sheila. I can't see Antoine. So if there's any problems, if somebody can just call that out, that would be much appreciated. So thanks again for the lovely introduction. As Sheila mentioned, my name is Anne-Marie Boutiette, and I'm the Ontario Caregiver Organization's regional lead for Eastern Ontario and Francophone communities. Thank you so much for inviting me to meet with your group today and for the opportunity to talk to you about our organization and to offer some tips and tools that will hopefully make your caregiving journey less stressful and prepare you in case of an emergency. So first of all, who and what is the Ontario Caregiver Organization? Simply put, the OCO, as we sometimes call ourselves for short, exists to improve the lives of Ontario caregivers regardless of age, of diagnosis of the care recipient, or of where they live in the province or in relation to their care recipient. So I know that not everyone here on this call lives in Ontario, and that's okay. I think that the information that I'll be sharing today applies regardless of where you live. And furthermore, the resources on our website can be accessed by anyone, regardless of where you're located. Also important to note, if you are a caregiver to someone who lives in Ontario, but you yourself live outside of the province, we can usually still allow participation in some of our higher touch programs. And I can talk a little bit more about that later. So how do we do this work? We do this, first of all, by providing free support directly to caregivers through our programs, our services, and our resources. We also do this by working together with healthcare providers to help them identify caregivers, include them in the process of caring for someone in the healthcare system, and to provide them with as much support as possible, and which could include connecting them to us, but also, hospitals more and more are implementing caregiver support programs as well. And so that's the work that we're supporting in those settings. We are also helping employers and workplaces develop caregiver inclusive cultures, practices, and policies at work so that working caregivers can stay employed and stay well, balancing both work and care. And finally, we also collaborate with different partners to support caregivers in new and innovative ways in the community and in other settings. So today we're going to start by looking at briefly at the caregiver experience. So what defines a caregiver and what impact does caregiving have on care recipients, but also on our community and on caregivers themselves. We're also going to talk about caregiver stress and ways to assess and manage the impacts of that stress on caregivers. And then we're going to talk about the importance of planning for emergencies as a caregiver, both as a way to minimize our stress, but also as a safety valve for ourselves and our care recipients. And then I will review some of the many ways in which the OCO can support caregivers in their journey. Knowing what to expect and being prepared for the practical side of caregiving is incredibly helpful. And one of the hardest things in life is when there's a gap between expectation and reality. But of course, you can never predict the future, and caregivers' paths are also very different, and each day can be different from the last. Aside from the inevitable uniqueness of each person's caregiving journey and the unique expectations and realities that go with that, there are some things that all caregivers need to prepare as best as they can. Throughout my presentation today, some things may resonate with you and others may not. Similarly, some of the resources or programs shared might feel helpful and interesting to you while others may not. So the goal is not to feel overwhelmed or to add more things to the to-do list, but rather to embrace the uniqueness of your situation and your journey and hopefully take away one tidbit or action that inspires you. So caregivers may take on some or all of the tasks that you see here on your screen. Maybe they do them every day, several times a day sometimes, or maybe they just do them once a month or once a year. The most reported roles are providing emotional support and transportation. And as you go through this list, which is by no means extensive, as you can, if you're a caregiver, as you can appreciate, just try making a mental list of the ones that you do. Well, I was going to say pop them into the chat. I don't know if you guys use a chat, but sometimes it's interesting to see the commonalities between people, and we start to see patterns in what people are doing. And this is a good exercise because if you've been a caregiver for a while, you're probably doing all of these things on autopilot without even really noticing, because they've become such a regular part of your everyday, right? A healthcare provider once told me that she heard it described as being crushed under a ton of feathers. So each individual task or responsibility seems really small and easy, but you add them together day after day, and eventually you're going to feel the weight of them. So it's important to acknowledge that, and it also helps to normalize some of the overwhelm that you're feeling and feeling really exhausted at the end of every day. And caregivers are numerous. We support, caregivers support, sorry, I say we because I'm a caregiver as well, support millions of patients across Ontario, and caregivers are overwhelmed. They play a critical role in the life of the people that they support, but also in the functioning of our society at large, so including our health, social, and community services. Caregivers provide an estimated 75% of care in our healthcare system, including work that would normally be done by a PSW or a nurse. So that means that for every hour that a client or a patient sees in a healthcare or support service setting, unpaid caregivers are doing an additional 3 hours behind the scenes. And that's roughly the work of 2.8 million full-time paid care providers in Ontario. The Canadian Centre for Caregiving Excellence has estimated that this is equivalent to a contribution of $97.1 billion annually to the Canadian care economy. So that's, quite significant. And no wonder that we feel tired and overwhelmed. And caregiving has an impact on every facet of caregivers' lives and really need to be considered as kind of a holistic entity. Caregiving takes a lot of time. 34% of caregivers provide more than 10 hours of care per week. And the amount of time that we spend on caregiving is significant because higher time commitments are associated with distress, and they also take away from time that we could spend on other or that we need to spend on other responsibilities. Caregiving like work, right? So caregiving makes it difficult to manage employment and achieve work-life balance. 67% of Ontario caregivers are employed, and 43% of those have considered quitting their job to provide care. Many caregivers do experience a loss of income and benefits, which is not ideal. Caregiving is expensive. On average, the out-of-pocket cost for a caregiver is $758 a month, and that's over $100 more than was reported last year. So in 1 year, we saw it increase by over $100. Not surprising because these costs represent things like fuel, right? Transportation, travel, accommodations, groceries, purchasing care or services for our loved one, supplies, home renovations. And 1 in 4 caregivers has taken out a loan or a line of credit to pay for care. And caregivers and their care recipient often live together and are dependent upon each other's financial contributions. So many caregiver slash care recipient households are financially strained because they're both being stretched. Looking at all those factors, not surprisingly, caregiving impacts our health and our wellness. 32% of caregivers say that they're not coping well mentally or emotionally, and 22% aren't coping well physically. Caregivers' plans and needs are often put on hold, and caregivers might lack the time for self-care and for their own health care appointments, for example. And finally, caregiving has impacts on our personal and family relationships. Caregivers experience, changing relationships with their care recipient. And 72% of caregivers say that they're so burnt out that they don't know how they're going to continue caring for the care recipient, which impacts their relationship. And then 76% tell us that they're not able to enjoy the activities of daily life. They don't have the time, they don't have the money, they don't have the energy, or all of the above to maintain relationships outside of their caregiver care recipient relationship. So caregivers are feeling isolated, and that isolation just seems to grow as the caregiving role runs on. I mean, but also, right, like it's important to acknowledge that caregiving obviously has its rewarding aspects. It can be really easy to, for days and weeks to just slip by, focusing on the daily needs and the stress. But it's important to also take a moment to pause and to reflect on some of the reasons why we do what we do as caregivers and how it aligns with our values. That's, one of the pieces around taking care of yourself and minimizing the impacts of stress is that whole, looking at the positive side of things and reframing things. And it can also encourage us, that's what's going to encourage us to keep going, right? To keep us motivated, especially when the days are long and difficult. So while we're reflecting on the rewards of caregiving, and realize that this can help build our resilience and bolster our serotonin levels, um, we know that the impacts of caregiving can be felt on our well-being and can lead us to experiencing higher rates of stress. And it's really important that we understand that we recognize it, recognize the signs of stress, and address it before it becomes irreversible. So, what exactly is stress? Really, it's just a natural physiological and psychological response to a perceived threat, perceived challenge that presents itself when the demands on us feel greater than the resources that we have to manage them. And there can be lots of factors that contribute to stress, ranging from things that are completely out of our control, like working in a system, right? Working in a healthcare social service system is can feel like we have no control over it. Also, things like staff shortages, wait lists, right? But there are things that are within our control, like the expectations that we place on ourselves and the ways that we prioritize our own wellness. Stress is something that our conscious brain often misses, especially after repeated exposure, and that's our brain protecting us. But if we pay attention, the signs can be observed in our body, in our physical health, right? In our mood and in our behavior. So you might think that you're managing your stress up here, but if you pay close attention to these other indicators, you might discover otherwise. So, for example, that nagging backache that seemed to come out of nowhere, or the cough from the cold that you had 3 months ago that just won't go away, that might be a sign. Or so might that spontaneous tearfulness or sudden loss of temper. And some caregivers will experience these at different stages of their caregiving. And oftentimes, these feelings will become normalized until you don't notice them anymore. But the toll is still being taken on your physical and mental health. And although stress and burnout are two different things, they do have overlapping symptoms. And if left unsupported, these warning signs of increased stress could lead to burnout. And so it's important to recognize the signs and to get support to not become a patient yourself. And burnout is much more difficult to overcome than day-to-day stress, right? Burnout is a state of physical, mental, and emotional exhaustion when you feel that you cannot find any hope in anything. Signs might be similar to stress, but perhaps they're amplified and or unmanageable. And caregivers are at a very high risk of burning out. So it's important to tune into ourselves and pay attention and to manage our stress as best as we can before it leads to burnout. So, while there are, several factors that are beyond our control, there are things that we can do to help manage what is within our control. So we'll touch on some of these right now. So the first thing you have to do is just check in with yourself, right? So one of the tools that we've developed, you see on the right, is our I Am a Caregiver toolkit. It's a little booklet that you can download from our website that has all of our programs and services listed with some descriptions in it, but it also has a couple of tools. And one of them is our stress self-assessment tool. So we suggest that caregivers use this frequently to check in with themselves. So if you look at the 9 questions on your screen, you can see that they touch on some of those signs of stress and burnout that we just reviewed, right? Not just the emotional things, but some of the physical things as well. So by checking in often, you start to establish what your baseline is and pay more attention to when things are changing. So, we suggest keeping that, post it on your fridge, keep it at your bedside, keep it in your car if you spend a lot of time in your car like I do. Or keep it anywhere that you're going to see it and scan it from time to time just to check in with yourself and see where you're at when it comes to your own feelings of stress and burnout, because your stress levels and experiences will change from day to day. Um, and when you're able to establish your baseline, you can start noticing changes as they happen. And the more you're in tune with your body and how it responds to stress, the easier it's going to be to take action before it's too late. So when you score yourself on that little quiz, um, you'll see that when you're lower on the score, you're managing your stress, right? You're managing well, but the higher you are on a numbers in the number, the closer you are to burnout. So we always every like our purpose is to encourage caregivers to be as proactive as possible versus being reactive. So that means that if you have scored low, we would still encourage you to find ways to take care of yourself every day. And if you found yourself on the higher end of the scoring, it might be time to seek some more professional help or some more specific help to help manage your mental health. So, talk to your doctor, talk to your healthcare professional, and access mental health support, such as counseling, for example. If you have a case manager or a navigator for your care recipient, reach out to them. Let them know how you're feeling and that you need more help for yourself. Important to advocate for yourself as well as for your care recipient. So, what do we mean when we talk about being proactive when we're in that lower, healthier stress zone? Well, we're talking about active prevention. We know that caregiving is a stressful job and that, anything can happen at any time. So active prevention helps us to stay as healthy as we can, both mentally and physically during the quiet times, but also during the stressful times, right? So kind of preparing the terrain. So, active prevention includes things like what you see on the screen, right? Getting adequate sleep, eating well, exercising, spending time with your friends, like continuing those relationships outside of the caring relationship, breathing, self-compassion, and we'll talk about self-compassion as well, and that mindfulness piece. One tool that we suggest to folks when you have the time to do something to take care of yourself, you maybe don't know what to do with yourself. So taking the time now when you have when things are taking the time when things are calmer and you're in a good headspace before you're in a crisis to develop your own wellness wheel, for example, can provide you with something useful to help keep in your back pocket, maybe even literally, right? Keep it in your back pocket, keep it in your purse when you are looking for ways that you can nourish yourself in all of these different categories. So, you might just have 15 minutes if you already have a list of things that nourish your soul, that bring you peace, that bring you, back to earth. If you have that list right there, you can quickly take advantage of one of those activities rather than spend more mental energy trying to think of what you can do to calm yourself. So it's kind of, present you gifting future you with something to help with your mental wellness. And if you're confronted with negative comments or judgments, right, which you might experience as a caregiver, it's really important to turn to self-compassion rather than becoming defensive or sitting in that negative space. Self-compassion really is about treating yourself with the same kind of gentleness, kindness, and encouragement that you would to a dear friend. So it really is one of those things that we are in control of and that we can do to improve our own mental well-being. So, it's really easy to fall into negative self-talk, especially when we're drowning in too many commitments or responsibilities. And our brain seems to be naturally wired to kind of go there. Um, but we do have complete control over how we talk to ourselves. And often it's the best way to counter the judgment of others. It does take practice, as I said, because our brain doesn't live in that positivity most of the time. But being able to turn negative self-talk into positive, affirming statements really is key to cultivating self-compassion. And it's also really important for you to be able to identify your caregiver strengths and then to draw on them to shape your caregiving and to just kind of reinforce your sense of, yeah, like I'm doing a really good job, right? Um, Sometimes we can feel really swallowed up by the ongoing demands of the caregiving role and caregiver responsibilities. But with reflection and focus on the strengths and the capabilities that you bring to the caregiver role, you can take greater control over your experiences. You can feel more confident in the care that you're giving, and it can enhance your well-being, right? So I know, for example, like, so I was a caregiver to my mom in the later stages of her Parkinson's and dementia diagnoses, along with my sister. And we each had our strengths, right? She was like, I was the organized one. I'm the one, kind of professional proclivities, connecting with this social services and getting the case management stuff organized. She was the one that did the day to day, helped with tasks around the house because she lives a lot closer, right? That she had more flexibility because she lived closer. They're in Quebec, I'm in Ontario, so she, took over those skills. And then together, like the two of us, our sense of humor is really what carried us through. Dark humor at times, but like you do what you can to get yourself through these difficult experiences and to bring some light and some sense of supporting each other in this role. So, if you do, though, find yourself at the higher scale of stress and getting closer to that level of burnout, we do again strongly encourage you to seek out professional and community supports and to think about emergency planning or building a backup plan. It's never too early or too late to reach out for help. And this, I guess, takes us to the next part of my presentation today, which is emergency and contingency planning. So, in terms of active planning that you can do to help relieve some of the stress of caregiving, especially if you're someone who worries a lot about, the future, um, having a contingency an emergency plan is it's an important step that you can take right now, right? Of course, we don't like to think about it, but unexpected emergencies can happen. And having plans in place to manage these emergencies can be very helpful. So today we're going to look at a couple of our toolkits that we've created to assist in creating these plans. Um, Emergency planning isn't only it's not only helpful, but it can also bring the caregiver peace of mind, knowing that there's some important and helpful things in place to support your loved one if something happens to you, if something happens around you. And having this peace of mind can really make it easier to live your life and to practice some important self-care. As we heard earlier, caregivers provide over 10 hours of care per week. It's about 11 to 30, supporting, a family member, a spouse, a friend, or a neighbor. The physical and emotional support that is provided by caregivers really is crucial to the health and well-being of their care recipient. So, what happens when the caregiver needs support? Burnout is at an all-time high with caregivers. Caregivers need their own support networks and a contingency plan for the person that they care for. And there's 5 steps to help you build a contingency plan. And we're going to go through all of these right now. So the first step is to reflect, to take stock of everything that you do, from daily living tasks, appointments, bill payments, and the I am a caregiver toolkit can help with this task. I mentioned there's a couple of tools in it. We are already talked about the stress assessment tool. The other tool is a checklist of all the things that you are probably, but might definitely be doing as a caregiver. So start taking stock of everything that you do with your care recipient and maybe start thinking about is there some things that I can already offload to other people in my circle? How many people would I need to, have on standby to do some of these things? So start to do that thinking and that kind of inventorying step. And then the next step is to really, as much as possible, work with your care recipient to plan ahead. Um, get their consent to share and document all of this information. Give them a voice in the process. And they might have information if they're still able to, if they're not in an advanced stage of neurocognitive decline, for example, make sure that they know and that you know where their important documents are, where their contact information, the contact details of the people that they rely on, where is that information? Where is everything located? And, we as an organization, we do recognize that you can receive and record this private and confidential information based on the following scenarios. So the care recipient, so the patient, if the patient has consented to their healthcare provider to share personal health information with you, then you can do that on their behalf. Or under the Healthcare Consent Act, the care recipient, if they've been legally tested for capacity to consent and deemed incapable, and you've been made the substitute decision maker, then you can provide consent for the collection, use, and disclosure of personal health information on the care recipient's behalf. So we do encourage folks to talk to the care recipients' healthcare providers and to ask them for a copy. Each a different, a doctor might have their own, or a hospital might have their own consent forms. If your care recipient is capable, to have them sign that as soon as possible, or if they're not, or if the doctor will accept verbal consent, to have that noted in their file. Even when the care recipient, just as a kind of a warning, even when the care recipient has consented to their information being shared, sometimes it can be difficult as a caregiver to get timely information from providers. And sometimes healthcare providers need reminders that they're permitted to share information with you based on the consent. So, that just a tip, maybe have that conversation with the doctor next time you see them, just to make sure that you have their consent. And then step 3 is to start building your team. Ideally, you should already have a team, but it's never too late, right? So consider family, friends, neighbors, and even professional care providers that could be a part of your team. If you don't have anybody that you can trust, there are some other options, such as the public guardian and trustee, or assisted living lists in the community for people that you care for. So things that you can record so you see the blue booklet on the right of your screen there, our contingency planning toolkit. There's a place there to note emergency contacts, to list who the care team is, to list all the services that are currently in place, right? Is there a meal service in place? Is there a physiotherapist that your care recipient goes to see every month, or maybe they come in the home? So there's spots to document all of that with their names, with their numbers, when they visit, where they visit, your care recipient's schedule, right? Really to have everything in one place. So if something happens to you, you can hand them this booklet, and they should be able to carry on on your behalf. We also have a lot of information on our website about advanced care planning and to to make some of the more decisions around power of attorney and those kinds of decisions. So there's please go to our website and have a look. And if you, I'll be sending, or I think your organization will be sending you this presentation. Um, every little document on there, if you click on them, will take you directly to that resource on our website. And then the fourth step is to document everything and to update it as required. So everything should be in one place. Our tip sheet and contingency plan worksheets can help you, right? So to document all of that, like I mentioned earlier, right? Contact information for doctors and clinics and the pharmacy and information about your care recipient's condition. Is there any allergies or medical alert information that needs to be considered? Um, if there's upcoming appointments, make sure that they're documented on there and update it as as time goes. Information about what they like, what they don't like, routines, foods that they prefer or that they really do not like. So, as I said, really meant to be something that you can give to somebody and they could take over. Medications. When do they take it? What are the doses? What are they for? One practice tip is that you should always have enough medication for 2 weeks in case you can't get to the pharmacy for any reason, and also ensure that your medications all have refills available. And then, stay connected with your team is the final step, and make sure that they have access to documentation that they're going to need. Does your backup person know where all the important information and documentation is stored? Do they have a copy of the contingency plan, etc.? The healthcare journey binder is another tool that we have that helps to keep your care recipients' medical information up to date and all in one place. And it's another great resource to help complete the contingency plan, especially if your care recipient has pretty complex needs or maybe, a number of different specialists and healthcare professionals involved. Um, and then in terms of emergencies, right? No matter how much we try to plan ahead, emergency situations can happen to anybody. So an emergency could involve a health concern, a missing person incident, a fire, a flood. It can happen to your care recipient, or it can happen to you, or it can happen to both of you. So thinking about having an emergency plan is it kind of goes with contingency planning. And also important to consider, do you need an emergency plan in case you feel unsafe in your caregiving role, right? Where can you go if your care recipient is someone that, you know, maybe gets violent or aggressive, or you just need a break? Do you have a plan for that? And it's not something that we like to think about, but it's important to have those backup plans in place. And at the end of the day, if information can be provided clearly and in a timely fashion in an emergency, it makes it so much easier to get the help that both you and your care recipient need. So one thing to note, the first place that EMS is going to look when when they come to your home, where they're going to look for emergency information, is behind or next to your front door and on the fridge. So consider having your contingency plan and your emergency information in one of those places, in both, all three, so that EMTs can quickly access that, which will then result in having much more timely help for you or for your loved one. Again, you can fill out an emergency information form which would be a lot shorter than the whole contingency plan. And there is a toolkit for that as well. And I'm pretty sure that I'm going to show it in an upcoming slide. And then, if you have a power of attorney, if you are a substitute decision maker and there's a legal document about that, have that available. Is there a DNR on file? Have that also posted somewhere where emergency personnel will be able to see it. Um, also have there's emergency preparedness checklist that can be a good start. This one we adapted from the Family Caregiver Alliance. It's linked on the slide. So to help you think through why and how to prepare, which is especially important when the person that you care for lives alone, maybe, but can also be a useful exercise for you and for your household, regardless of your caregiver situation. And if you are connected with community support services, often they can be of assistance as you prepare. So, think about first aid kits, non-perishable food, water supply, emergency kits, medication supply, but also where are the emergency shelters in your community, the cooling centers, the warming centers? What are the most likely natural events that could impact your ability to leave the house for a few days? I know where I am, it's probably a snow day that might keep us at home for a couple of days. So, whereas if it's in Florida, it's probably a hurricane. So, and so prepare accordingly to what you might have to expect. So, to make the process of documenting your emergency plan, we did adapt this booklet from that with permission from the Alzheimer's Society of Ontario. So just put this completed package on the back of the front door or on the fridge so that emergency services can get an understanding of who's in the space and what they might need. This can also be helpful if a vulnerable person goes missing, right? So call 911 right away, provide this package to police, keep an extra copy on hand, keep it in a safe place, and make updates as required. So as you've seen, we have a number of tools to help you prepare and implement these plans. And I've kind of touched on all of them here this morning. Again, if you click on any of these on this page, it'll take you directly to those documents on our website. And then go back, there we go. So how can OCO support caregivers? So we have a number of free programs and services in French and in English. All the tools that I mentioned today are also available in French. And we have a 24/7 caregiver helpline that's available to caregivers in Ontario to help you find resources in your community and to help you find also resources on our website. If you can't find something, they can also help you with registering for some of our programs. We have peer support we have group support on a virtual platform. And we also have one-to-one peer support. So you can be matched with a peer mentor and it looks like a phone call once a week just to reach out and have somebody to talk to, have somebody to help you, vent some of the difficult emotions that you might be going through, and just to get that emotional support and that validation as well. SCALE is it stands for Supporting Caregiver Awareness, Learning, and Empowerment. It's an 8-week psychoeducational series. It just started yesterday. We offer it twice a year. It's not too late to register if you're interested. And the focus of SCALE is really that mental and emotional well-being. Every week we talk about one of those difficult emotions that, we aren't prepared for when we become caregivers. We don't really realize the emotional impact that it's going to have on us, whether it's the guilt, the shame, the frustration, the anger, just a general overwhelm. And so every week we break down one of those emotions. And then there's also group counseling support offered every week, as well as and the opportunity to work with a counselor one-to-one on a first come, first served basis. You can work with a counselor up to 3 sessions. We also offer caregiver coaching, which is another therapeutic approach to problem solving. It's not counseling, it's really task focused. So you can work with a coach for up to 6 sessions to work through either a new or a challenging situation in your caregiving journey. And the goal is to get you back on track and feeling that you're equipped to do this. We offer webinars once a month in English, and we have up to 8. We're up to 8 now in French. Most of them are recorded and live on our website after they've been aired. Tons, as you've seen, toolkits and tip sheets on various topics. We have a podcast, we have some newsletters, and we also have a portal for young caregivers because there are a lot of young caregivers, and young caregivers are, anywhere from like 15 to 25, taking care of a parent, a sibling, or another family member, and they have their own set of challenges. So we try to support them as well. So that takes me to the end of my presentation. I hope we still have time. Oh yeah, got some time for some questions. So I'll leave this slide up for just a couple of minutes so you can jot down my email address and maybe click on the link to either subscribe to our newsletter. I would really enjoy getting some feedback from you today too. So if you can click on that link on the right-hand side and just keep that tab open and you can fill out the evaluation after we're done today, I would really appreciate it. All right, so I'm going to stop sharing now and
Thank you, Anne Marie.
you're welcome. Thank
As
you.
as a caregiver myself, I found the content
Mm-hmm.
very beneficial,
Good.
and the section on contingency planning, I think, is really important. So I hope people will take advantage of that particular set of information. We do
Mm-hmm.
have a few questions that have come in,
Okay,
so let me get right to them. It
sure.
is not clear if this program is for a caretaker or for senior people who need or who have caretakers.
Okay. So great question. So just to clarify, so we are here to support the unpaid caregivers. So the person who is looking after a family member, a neighbor, a friend. That's who our clientele is, or who our target audience is. So we're not talking here about, I know I get this a lot when I go to events, right? People, often it's a senior person who lives alone and they think that we're here to help them find a caregiver. That's not what we do. There's plenty of organizations that can help with that, though. And I'm sure if you called our helpline, we could help give you some contact information. But really, our focus is on the caregivers, recognizing that they are really overwhelmed, that there's it's a pretty steep learning curve, and both administratively, but also emotionally. And so we're there to support that piece.
Okay. Next question really goes to what you just said.
Yes.
From where can I hire a caretaker with the help? Sorry, my screen it just went up there. Okay, sorry. From where can I hire a caretaker with the help of Champlain? I guess they're talking about Ontario Health at Home.
Yeah.
They asked me to hire a private caretaker.
Yeah. I would reach out to, so Ontario Health at Home should be able to provide you with lists of trusted agencies. I would start there, um, and look to see if you're in the Ottawa area. There's a couple of organizations. There's the Western Ottawa Resource Center and the Eastern Ottawa Resource Center. They can probably help you as well find some resources in terms of private care providers.
Okay. What to do if, I'm not sure what this means.
Oh, there's another
Are,
one too, I think.
oh, if PGT report, maybe, or
Oh,
representative?
public guardian and trustee.
Oh, okay. Sorry, I wasn't familiar with that. Is not doing their job, not paying bills for you or your loved one, or very late in paying the rent at the retirement home.
Um, I think, I don't, my recommendation would be to reach the ombudsman. That's kind of their job to monitor public services like this and to handle complaints. If you have already filed a complaint with the public guardian and trustee and you're not getting anywhere, that would be my next step.
Okay, thank you. Another question here. Can I claim caretaker expenses when filing income tax?
Mhm.
What rules do I need to look at, or do I have to have when I hire private care? And there are several follow-up
Yeah.
questions to
Yeah.
that.
Yeah. So yes, the short answer is um, depending on your age, or if you are already identified as having a disability. So you can write off or expense deduct those expenses on your income tax return. We're actually hosting our next webinar in February is with Canada Revenue. They're going to be talking about the new disability tax benefits. So it might be interesting to tune into that. Um, the the broadcast, I want to say, hang on, let me I can find out when. Um, our next webinar is. Uh, I want to say February 19th. Um, 25th. So February 25th. It's always at noon. But if you're not available at that date, that time, I would still register because you'll get a follow-up email with some information. The Canada Revenue Agency, though, is one of the two agencies that don't allow us to record there because the information changes all the time. So if you are able to tune in to the live, that would be really good. Or talk to someone. I know it's difficult to get through sometimes, but pardon me, talking to somebody at CRA or going on their website, you can find out information around how to fill out your income tax return, where you can put that. If you are the power of attorney for your care recipient, you can file that on yours. If they're a dependent of yours, you can file it on yours, or you can file it on theirs to get a return.
I'd also like to mention that one of our upcoming webinars this month is also with a representative from CRA
Great,
about the benefits, tax benefits and credits for persons over 65, I do believe.
great, great.
So that's coming up this month here as well.
Tune in.
So lots of information out there.
And you'll have a
Okay,
person there to ask questions too, right? That will be able to answer
yeah,
them much more
yes.
effectively than I can.
So another question, is there a cost involved with one-to-one peer counseling
Mhm.
for a caregiver who is in a long-term care facility?
So all of our programs at the OCO and services are free of charge to caregivers in Ontario. So yeah, our peer support programs, the caregiver coaching, the scale program, our webinars, everything is free.
Okay. Has OCO considered sending these caregiver toolkits to long-term care facilities?
So part of the work that we're doing is engaging with long-term care and other hospital and healthcare settings to raise awareness about the importance of caregivers and to provide them with the tools. So some long-term care homes already have our toolkits. We actually have developed one specifically for caregivers of folks that are in long-term care. Um, if you want to reach out to me, if there's a long-term care facility that you would like us to connect with and provide them with those tools, I'm more than happy to get that sent out to them and to connect with them.
Okay, thank you. We have time for one final question.
Mhm.
What to do if the family doctor refuses to remove a medication that was prescribed by a psychiatrist and to remove themselves as the family doctor?
Mhm.
Um, how do I enforce my power of attorney for health and request that this medication be removed if they don't want to?
Mhm. Mhm. That's a really difficult situation. If you have the POA for personal care, um, you should be able to make that decision. So I can't give legal advice. I think you might have to talk to a lawyer about that. It sounds like, or have the psychiatrist maybe have a meeting with the psychiatrist and the doctor to all kind of go over the reasons why one feels so strongly and the other feels so strongly the other way, right?
Okay, thank you. That's all. I'm sorry, everyone. That's all the time that we have for this morning for questions. Feel free, of course, to email Anne Marie afterwards. Her email address was up on the screen. So if we didn't have time to have your question answered, please feel free to contact Anne Marie.
Hmm.
Um, so thank you, Anne Marie,
Thank you.
for your presentation today. And I also want to thank everyone who participated and joined in today. A most informative webinar. Lots of really interesting, beneficial content. Thank you.
Thank you.
So please look out for our follow-up email that will come from the branch that will contain the recording for today's webinar as well as the presentation slides. And also remember that you can invite non-members to attend our webinars and try us out as a guest. To register for upcoming webinars, please visit the Ottawa branch website at nafrottawa.com. Thank you so much again, Anne-Marie. Merci à tous and have a great day, everyone. Bonne journée.
Merci. Bye bye.
Bye bye.